I'm Roger Friedman of Ohio ENT and Allergy Physicians, and oftentimes people ask us, what is an allergist and what does an allergist do? Well, first of all, an allergist, of course, is a physician, someone who went to medical school for 4 years, then did a residency in either pediatrics or internal medicine. Some of our physicians actually did both internal medicine and pediatrics. Once they're done with their residency, they then do a subspecialty, either 2 or 3 years of allergy training. An allergist specializes in taking care of immunologic and allergy diseases. Typically, those include the diseases such as allergic rhinitis, or what most people call hay fever. So we treat lots of children and adults who have runny noses, stuffy nose, sneezy nose, itchy, watery eyes. Typically, they'll be caused by the outdoor allergens like ragweed, trees, grass, or indoor allergens like dust mites, cats, and dogs. We'll try to evaluate those patients, often doing allergy skin testing, to determine whether in fact they do have allergies, and if they do, we usually have a way of treating them. We try to avoid things we're allergic to, we take medications, and if medicines and avoidance don't work, then we're the experts in allergy shots. That's called immunotherapy, and immunotherapy is incredibly effective in not only making patients' symptoms better, but also in sometimes curing the problem, actually turning off the whole immune system and making them better. In addition, allergists are experts in treating asthma. That's probably the second most common disease we get to treat, and the reason is that asthma is very often caused by allergies. By evaluating a person who has asthma for allergies, we can often determine that if the allergies are causing the problem, by treating allergies, we may be able to improve asthma care or maybe even cure that asthma. The third disease that we treat a great deal of are food allergies. They become a big part of the allergist practice, and as probably most of you know, food allergies have become an increasing problem in America. We now are up to 8 to 10% of the population have food allergies, and this dreaded peanut and tree nut allergy, which can be life-threatening, again is diagnosed by the allergist, and once we can make the diagnosis, we work well with the families in trying to avoid the offending allergen. In the not too distant future, we've got some exciting news where we're going to be able to finally treat food allergies. We're either going to have a food allergy patch or a sublingual underneath the tongue treatment or an oral treatment. This is still in investigation, but hopefully in the next 2, 3, or 4 years, we're going to have an incredible thing to offer our patients. And again, being able to make food allergies less dangerous and maybe even to cure the vast majority of our patients who have food allergies. There are a number of other diseases that the allergist and immunologist treat. In particular, we treat children and adults with hives. We treat children and adults who have angioedema and make sure they don't have a very rare form of angioedema called hereditary angioedema, which can be life-threatening. It's important for a specialist to try to determine that, as we, again, now have new treatments, but if we know they don't have that disease, some of our older treatments for hives can still be very effective. One of the last diseases that it's important that we treat is immune deficiency problems. Again, the allergist immunologist is expert at treating children and adults who have a congenital problem with their immune system. Many of our adult patients and some children may have conditions called common variable immunodeficiency or a low gamma globulin level. When we make that diagnosis, we can place those patients on gamma globulin therapy. In the old days, we had to send them to hospitals for infusions, but now many of our patients can be treated at home with subcutaneous gamma globulin. And then lastly, we oftentimes collaborate with our pediatricians and our dermatologists in treating children and adults with eczema. Eczema can very often be related to foods or environmental allergens, and we're expert at helping to determine that. And once we know what a patient is allergic to, again, avoidance may make a major difference, such as avoiding a food, avoiding a pet, avoiding dust mites, or if not, medications, either creams or oral medications, and in some instances, allergy shots can be effective for the treatment of eczema, again, just like hay fever and asthma. It's an exciting time to be an allergist because there are so many new therapies and new understanding of the immune system that can help our patients.